I'm Heather Strah, and I grew up in central Iowa, and then went to the University of Iowa for medical school, went out to Pittsburgh for residency at the University of Pittsburgh, and then went to Pulmonary Fellowship at Washington University in St. Louis before coming here to join the faculty at UNMC. So the most common conditions that I see are people who have advanced lung diseases and more extreme examples of advanced lung diseases. So people with severe COPD, severe emphysema, interstitial lung diseases, IPF, sarcoidosis, people who have severe limitations in what they're able to do, as well as patients with cystic fibrosis who have exhausted their medical options. And my goal for patients who have these severe limitations in their daily activity is to give them a new opportunity and a chance for a new quality of life, a better quality of life with a lung transplant. As I went into my training and further along in my education, I realized that what I really loved was taking care of people who had advanced lung disease and being involved with their care both in the acute phase in the hospital, but also in the outpatient setting and long term. The first time I sit down with a patient, the most important thing that I am interested in is sort of what their goal for seeing me is. Obviously everyone who comes to see me is hoping to get a lung transplant, but what are they hoping to get out of having a lung transplant? And, is it someone who wants to see their grandkids grow up or wants to be able to go back to work, someone who wants to go to college? Because the range of ages in patients that I see, goes from the young to, people in their 60s. And so there are a lot of different goals that patients have out of being evaluated for a lung transplant. The biggest thing about an academic environment is that patients are going to get the unique experience of working with me and getting my opinion, but also getting the opinion of my colleagues, the trainees that I work with, the pharmacist, and it provides an exceptional multidisciplinary experience for a patient that elevates their level of care above and beyond what they might see in the community.